Sterling Pharmaceuticals. I stared at the name on the merger proposal sitting on my desk, my coffee going cold in my hand. It had been 9 years since I'd heard that name spoken in anything other than hushed, bitter tones in my own mind. 9 years since my father, Richard Sterling, CEO and founder, had told me I was wasting everyone's time pursuing medicine. 9 years since he'd said those exact words at my college graduation party, in front of 50 guests, while my younger sister Emma beamed beside him in her new consulting job offer from his company. Medical school? He'd laughed, actually laughed, swirling his scotch. Sweetheart, you barely made it through organic chemistry. Your sister's got the head for business, the strategic thinking. That's real value. Medicine? He'd waved his hand dismissively. Nurses make good money. Have you considered that instead? I'd left that party early. I'd left a lot of things early after that. Now, I pulled the proposal closer, scanning the executive summary. Sterling Pharmaceuticals, once valued at $800 million, was drowning. Failed drug trials. FDA violations. A class action lawsuit that had decimated their market cap. They were seeking a strategic merger with my company, Meridian Biotech, to stay afloat. My company, the one I'd built from my tiny apartment with 2 other researchers after finishing my MD-PhD at Johns Hopkins. The one that just got our 3rd drug approved by the FDA last month. The one now valued at $3.2 billion. I was 32 years old and the chief scientific officer of one of the fastest-growing biotech companies in the Northeast. The meeting was scheduled for tomorrow at 2 p.m. My hands were shaking. I made myself breathe slowly, the way my therapist had taught me. Dr. Morrison's voice echoed in my head. Your father's opinion of you 9 years ago doesn't define your reality today, Sarah. But God, it still hurt. Let me go back. Let me tell you how I got here, so you understand why my chest felt like it was caving in. I grew up in Greenwich, Connecticut, in a house with more square footage than warmth. My father built Sterling Pharmaceuticals from nothing, starting in our garage when I was 5. By the time I was 10, we'd moved to the estate. By the time I was 15, he was on the cover of Forbes. I worshipped him. Every night at dinner, I'd ask him about his day, about the science, about how drugs got developed. He'd smile absently and turn to Emma, asking about her mock trial tournament or her debate competition. Emma was 3 years younger, but she was the one he'd take to company events, introducing as my successor. I studied constantly. Perfect grades weren't enough, so I joined every science club, did summer research programs at Yale, volunteered at the hospital. When I got into Harvard for undergrad, I thought maybe, finally, he'd see me. That's fine, he'd said, not looking up from his phone. Emma got into Princeton. Their business program is top-ranked. I should have seen it then. Should have stopped trying. But I kept going, kept pushing, kept thinking if I just achieved enough, worked hard enough, proved myself enough, he'd look at me the way he looked at Emma. Medical school applications. I spent months on them. Got into Johns Hopkins, Columbia, Penn. I chose Hopkins because their MD-PhD program was the best. Because I wanted to do both research and clinical work. Because I thought combining business and science might finally bridge the gap. I called him from my apartment, hands shaking with excitement. Dad, I got in. Johns Hopkins MD-PhD program. Full scholarship. They want me to focus on oncology research and... Sarah. His voice was tired. I'm in a meeting. We'll talk later. We didn't talk later. 3 days before my white coat ceremony, I texted him the details. He replied, Emma's presenting at a conference that week. Can't make it. Congrats though. He made it to Emma's graduation from business school. I saw the photos on Facebook. He'd flown to Princeton, took her to dinner at a Michelin-starred restaurant, posted about how proud he was of his brilliant daughter joining the family business. I cried in my apartment for 2 hours, then I made a decision. I was done. Done trying to win approval that was never coming. Done measuring my worth by whether he showed up. Done entirely. I changed my last name legally. Sarah Sterling became Sarah Chen, taking my mother's maiden name. Mom had passed away from ovarian cancer when I was 19, and Dad had remarried within a year to a woman who worked in his marketing department. Using Chen felt like honoring the one parent who'd actually seen me. I threw myself into my research. 12-hour days in the lab. Overnight shifts at the hospital. I was good at it, really good. My advisor, Dr. Patricia Lee, became the mentor my father had never been. You have an incredible mind, Sarah, she told me after I'd presented my thesis on targeted cancer therapies. Have you thought about entrepreneurship? This research could change lives, but it needs funding, infrastructure. I hadn't thought about it. Business was Emma's world, Dad's world. But Dr. Lee introduced me to two other researchers, Marcus Webb and Jennifer Park, who had the same frustration, brilliant science stuck in academic limbo, while patients died waiting. We started Meridian Biotech in my studio apartment in Baltimore. I was 26, had just finished my MD PhD, was starting my oncology residency, and was somehow also running a startup with money we'd scraped together from grants and a small angel investment. The first 2 years were brutal. I'd work 30-hour shifts at the hospital, then come home and work on Meridian until I passed out. We were developing a targeted therapy for triple-negative breast cancer, the kind that had killed my mother, the kind that had no good treatment options. I didn't tell my father. Didn't tell Emma. I'd blocked them both on social media after Emma posted a photo of her promotion to VP of Strategic Development at Sterling Pharma with the caption following in Dad's footsteps, number proud daughter, number family legacy. Year 3, we got our first major funding round. $15 million from a venture capital firm that believed in our science. I quit my residency, went all in on Meridian. Marcus handled operations, Jennifer led clinical trials, I was CSO focusing on research and development. Year 4, our first drug entered phase 2 trials. Year 5, it passed phase 3 with flying colors. Year 6, FDA approval. A targeted therapy for triple-negative breast cancer that extended survival by an average of 3.2 years. We called it Meridian 1. The night we got FDA approval, Dr. Lee took us out to celebrate. Your mother would be so proud, she said, squeezing my hand. I excused myself to the bathroom and cried. Year 7, we IPO'd. The company valuation hit $1.8 billion. I was 29 and a multimillionaire on paper. We hired aggressively, expanded our research, started developing 3 more drugs for different cancer types. Year 8, Meridian 2 got approved, a treatment for late-stage ovarian cancer. Our market cap doubled. Year 9, last month, Meridian 3 got approved for pancreatic cancer. We were now valued at $3.2 billion, had over 800 employees across 3 facilities, and were being called the future of oncology by Forbes. The same magazine that had once featured my father now featured me, different last name. He didn't know. I hadn't spoken to him in 9 years. Hadn't spoken to Emma in 9 years. As far as I knew, they thought I was still just a doctor somewhere, maybe struggling to pay off student loans, probably filled with regret that I hadn't listened to Dad's advice about nursing. The idea made me feel sick and satisfied in equal measure. I'd worked with a therapist for 3 years to process it all. The abandonment, the favoritism, the constant message that I wasn't good enough. Dr. Morrison had helped me understand that my father's inability to see my worth said everything about him and nothing about me. But knowing that intellectually and feeling it emotionally were 2 different things. Which brought me back to the proposal on my desk. Sterling Pharmaceuticals was dying. According to the documents, they'd had 3 major drug trials fail in the past 18 months. The FDA had cited them for manufacturing violations at their main facility. The lawsuit from patients who'd suffered adverse effects from one of their medications had settled for $200 million, money they didn't have. Their stock had dropped from $83 per share to $11. They were desperate. The proposal outlined a merger structure where Meridian would acquire Sterling's assets, assume some of their debt, and integrate their remaining research teams. It was actually not a terrible deal for us. They had some promising early-stage research and a manufacturing facility we could use. The meeting request had come through official channels. Our VP of Corporate Development, James, had forwarded it to me with a note. Could be interesting. They're a mess, but the manufacturing infrastructure alone might be worth it. Their CEO is coming personally to pitch. Let me know if you want to take this meeting or pass. Their CEO. Richard Sterling. My father. I could pass. I could tell James to handle it. I could avoid the whole situation. Instead, I found myself typing, "I'll take the meeting." Tomorrow, 2 p.m. works. Conference room A. I spent that night unable to sleep. Part of me wanted to cancel. Part of me wanted to show up and say nothing, let him pitch his desperate proposal without ever knowing who I was. Part of me wanted to walk in and announce myself immediately, just to see his face. I practiced in the mirror at 6 a.m., exhausted and wired on too much coffee. Hello, Dad. Remember me? Too bitter. Richard. Thank you for coming in. Too cold. It's been a while. Too vague. I settled on just letting it play out. I'd figure it out when I saw him. I wore my navy suit, the one I'd bought after our IPO, the one that made me feel powerful and professional. I braided my hair the way Mom used to braid it. I looked at myself in the mirror and barely recognized the confident woman looking back. Would he recognize me? I'd lost 30 pounds since he'd last seen me, stress from the startup years. I'd cut my hair from waist length to shoulder length. I'd stopped wearing the glasses I'd had in medical school, switched to contacts. My face had thinned out, matured. I was 32 now, not 23, and I had a different last name on every single piece of company material. Dr. Sarah Chen, Chief Scientific Officer. Not Sterling. The morning crawled by. I couldn't focus on anything. Jennifer stopped by my office at noon. You okay? You seem off. Jennifer was more than a co-founder. She'd become my closest friend, the sister I'd lost when Emma chose Dad over any relationship with me. The Sterling Pharma meeting, I said slowly. The CEO. He's my father. Her eyes went wide. Your father? The one who? Yeah, Sarah. She sat down across from my desk. You don't have to do this. We can reschedule. James can handle it. I know. I twisted my pen between my fingers. But I want to. I think I need to. Okay. She studied my face. Do you want me in there with you? Yes, I said immediately. Please. At 1:55 p.m., I walked to conference room A. Jennifer was already there, along with James and Marcus. The room had floor-to-ceiling windows overlooking Boston Harbor, a long glass table, and leather chairs that cost more than my first car. At 2 p.m. exactly, our receptionist showed them in. Richard Sterling walked in first. He was 58 now, hair grayer than I remembered, lines deeper around his eyes. He wore an expensive suit that couldn't quite hide how tired he looked. Behind him came Emma, 29 now, her blonde hair in a sleek ponytail, wearing a dress that screamed expensive and professional. And behind them, a lawyer and their CFO. My father's eyes swept the room, professional and assessing. They passed right over me. No recognition. Nothing. Emma's eyes did the same. Not even a flicker. 9 years, and they looked at me like I was a stranger. My throat went tight, but I kept my face neutral. Dr. Chen, my father said, extending his hand to me. His voice was exactly the same. Richard Sterling. Thank you for taking this meeting. I shook his hand. His grip was firm, professional. Mr. Sterling, I said. My voice came out steady. Please, sit down. They settled into chairs across from us. Emma sat beside my father, already pulling out her tablet. This is my daughter, Emma Sterling, our VP of Strategic Development, my father said, gesturing to her. Our CFO, Michael Torres, and our attorney, David Kim. Emma gave me a professional smile. We're really excited about the possibility of partnering with Meridian. What you've built here is incredible, Dr. Chen. Thank you, I said. I watched them. They watched me. No one knew. My father launched into his pitch. Sterling Pharmaceuticals has been a leader in pharmaceutical development for 28 years. We've recently faced some challenges, but our core research remains strong. We believe a strategic partnership with Meridian could benefit both companies. He was smooth, professional, desperate underneath it all. I could see it in the tightness around his eyes, the way his hand trembled slightly when he pulled up their presentation on the screen. He talked about their manufacturing capabilities, their research pipeline, their temporary setbacks that were actually catastrophic failures. He positioned the merger as a win-win when it was clearly a lifeline they desperately needed. Emma jumped in with financial projections, synergy analyses, integration timelines. She was good at this, I realized. Competent and polished. I let them talk for 30 minutes. Then I started asking questions. Your FDA violations, I said, looking at their CFO. The citation mentioned manufacturing protocol breaches at your primary facility. What's the current status of remediation? Michael shifted uncomfortably. We've implemented new quality control measures. Implemented or planning to implement. We're in the planning phase, he admitted. I made a note. And the ongoing litigation from the Stellar side adverse effects. Your documents say it's settled, but there are 3 more cases pending. My father's jaw tightened. Those are frivolous suits. Our product warning labels were compliant. Were they compliant with the 2019 FDA labeling requirements or the 2017 ones? I kept my voice professional. Because the language looks like the older version. Silence. Emma glanced at the lawyer, who looked uncomfortable. I pressed on. Your Phase 3 trial for Sterling 24, the Alzheimer's drug. It failed to meet primary endpoints 6 months ago. But you continued spending on it for another 3 months. Why? We believed the data would improve, my father started. The data won't improve if your trial design was flawed from the start, I said. Your patient selection criteria excluded people with comorbidities, but that's exactly the population who would actually use this drug. You optimized for trial success, not real-world application. My father's face flushed. Dr. Chen, I've been in this industry for 28 years. And I've been in it for 9, I said calmly, with 3 FDA-approved drugs and a 4th in Phase 3 trials. So respectfully, your experience hasn't prevented Sterling from failing multiple trials and facing regulatory violations. The room went silent. Jennifer was trying not to smile. Marcus was studying his notes intently. James looked impressed. Emma leaned forward. Dr. Chen, I understand you have concerns, but I have questions, not concerns, I said. Because if Meridian acquires Sterling, we assume your liabilities. That includes the pending litigation, the FDA remediation costs, the failed trial write-offs. I need to understand exactly what we'd be taking on. My father's hands were flat on the table now. I could see him struggling to maintain composure. We've provided comprehensive financial disclosure. You've provided what your lawyers approved, I interrupted. That's not the same as comprehensive. I watched him the way he used to watch people in negotiations. Assessing, calculating, finding weaknesses. Let me be direct, I said. Sterling Pharmaceuticals is worth about $300 million on paper. But realistically, with your liabilities, you're probably worth half that. Maybe less. Your manufacturing facility is outdated, your research pipeline is weak, and your leadership has made multiple critical errors in the past 2 years. My father's face was red now. Now wait just a minute. I'm not finished, I said quietly. The quiet was worse than shouting. He stopped. The only reason we're even considering this is because you have some early-stage research that shows promise, and we could use your facility space if we completely overhaul it. But that would cost us another $50 million, minimum. I leaned back in my chair. So here's my question. Why should Meridian risk our reputation and resources on a company that's shown such poor judgment? The silence was deafening. My father stared at me. Really looked at me, for maybe the first time in this meeting. I saw the wheels turning behind his eyes. Professional mask cracking. Your facility, Emma tried, her voice slightly shaky. It's FDA compliant, and the location. Your facility has violations pending, I said, not looking away from my father. Location means nothing if we have to shut it down for 6 months for remediation. My father's voice was tight when he spoke. Dr. Chen, I understand you're in a position of strength here. But I built Sterling from nothing. I know pharmaceutical development inside and out. Our current situation is temporary, is it? I asked. Because from where I'm sitting, it looks like a pattern. Failed trials suggest flawed research methodology. FDA violations suggest quality control issues. Financial problems suggest mismanagement. Something flashed across his face. Anger. Humiliation. The same look he used to get when his board questioned his decisions. We've hit a rough patch, he said tightly. Every company does. Meridian hasn't, I said simply. Emma's tablet clattered slightly as she set it down too hard. Dr. Chen, respectfully, Meridian is 9 years old. Sterling has decades of 9 years old with 3 approved drugs and a $4 billion market cap, Jennifer interjected quietly. Perhaps longevity isn't the metric we should focus on. I watched my father's face. Still no recognition. Just anger, defensiveness, desperation. Mr. Sterling, I said, I appreciate you coming here today. But I think we need to see significant changes before Meridian would seriously consider a merger. What kind of changes? He asked tightly. Leadership changes, I said bluntly. New CEO. New research director. Complete overhaul of your quality control systems. Remediation of all FDA violations before we'd even begin negotiations. His face went pale. You're asking me to step down from my own company. I'm saying that Sterling's current leadership got you into this position, I replied. Why would we trust that same leadership to get you out? Emma stood up abruptly. This is ridiculous. Dad built this company from nothing. And drove it into the ground, I said, looking at her for the first time. Really looking at her. Sentiment doesn't fix failed trials and FDA violations. She stared at me. Opened her mouth. Closed it. My father stood slowly. His hands were shaking. Dr. Chen, I came here in good faith. And I'm giving you good advice, I said, standing to face him. We were the same height now. When had that happened? Sterling needs to change everything if it wants to survive. Starting with leadership that actually understands modern drug development. I understand drug development, he said, voice rising. I was developing drugs when you were. He stopped. Blinked. In the silence, I saw it. The moment. The way his eyes narrowed, really looking at my face. The way his expression shifted from anger to confusion to dawning, impossible recognition. When I was what? I asked softly. When I was in medical school. When I was wasting my time pursuing medicine instead of getting a real job. His face drained of all color. Sarah? Emma's head snapped toward me. What? I smiled, but it wasn't kind. Hi, Dad. It's been a while. Sarah, he repeated, like the name didn't make sense. Your Dr. Chen is Sarah Chen, I confirmed. I changed my name 9 years ago. When you skipped my white coat ceremony to go to Emma's business school event. Remember? Emma was standing now too. Sarah? But you went to medical school. I finished medical school, I said, still looking at my father. MD PhD from Hopkins. Oncology research. Then I started a little company in my apartment with 2 colleagues. You might have heard of it. It's called Meridian Biotech. My father sank back into his chair. He looked like he might be sick. You're the founder, he whispered. The CSO. You built. I built the company that just got our 3rd drug approved by the FDA, yes, I said. The company worth $3.2 billion. The one you're currently begging to save your failing business. Emma's mouth was open. No sound coming out. I sat back down, smoothed my jacket. So, to reiterate, if you want Meridian to consider a merger, you'll need new leadership. Someone who actually knows what they're doing. Someone who understands that science isn't about ego, it's about helping patients. My father's voice was barely audible. Sarah, I didn't know. No, I agreed. You didn't. You didn't know because you never looked. Not 9 years ago. Not when you walked into this conference room today. You looked right through me both times. Tears were welling in Emma's eyes. Sarah, we thought we didn't know where you were. You didn't ask, I said. My voice was steady, but my hands were shaking under the table. You had my phone number for 3 more years before I changed it. You never called. My father's voice cracked. I didn't think your mother always said you were brilliant, but I thought. You thought I'd fail. I finished. You thought medical school was a waste. You thought I should be a nurse. You thought Emma was the brilliant one. He couldn't look at me. Good. Mr. Sterling, I said formally. I think we're done here. James will follow up with our decision about the merger proposal within 2 weeks. Sarah, please, my father started. It's Dr. Chen, I said quietly. In this office, that's what you call me. They left. Emma was crying. My father looked like he'd aged 10 years. I watched them walk out through our glass lobby, past our logo, Past the framed Forbes article about me with the headline "The Future of Oncology: How Dr. Sarah Chen's Meridian Biotech is Revolutionizing Cancer Treatment." He'd walked right past it when he arrived. Hadn't even noticed. When they were gone, Jennifer put her hand on my shoulder. "You okay?" I wasn't crying. I thought I would be. Instead, I felt empty. Tired. "I don't know. You were incredible," Marcus said. "Absolutely ruthless." "He deserved it," James added. "Did he?" I asked. "Or did I just become exactly like him? Ruthless. Dismissive. Using power to humiliate someone." Jennifer squeezed my shoulder. "You were honest. You were professional. You held him accountable. That's not the same as what he did to you." I wanted to believe her. That night, alone in my apartment, I stared at my phone. No calls. No texts from him or Emma. Still nothing. What had I expected? That he'd immediately grovel. That one confrontation would undo 9 years of silence. 2 days later, an email arrived. Personal, to my company account. From Richard Sterling. The subject line: "I'm sorry." I stared at it for an hour before opening it. "Sarah, I don't know if you'll read this. I don't blame you if you delete it immediately. I've spent the past 48 hours trying to understand how I failed you so completely. I've read every article about Meridian. I've watched your interview on CNBC. I've read your research papers. You were right there. You were brilliant and determined and exactly the kind of person I should have been proud to call my daughter. And I was so blind, so focused on my own narrow definition of success that I couldn't see it. I told you medicine was a waste because I was scared. Your mother died despite all the doctors, despite all the medicine, and I think I blamed the entire field. When you said you wanted to become a doctor, all I could think about was how helpless I felt watching her die. That's not an excuse. It's an explanation you deserved 9 years ago. I was wrong. About everything. You weren't wasting your time. You weren't less capable than Emma. You weren't someone who needed to settle for less. You're extraordinary. What you've built is extraordinary. And I missed it because I was a fool who couldn't see past his own pain and prejudice. I don't expect you to forgive me. I don't expect anything from you. But I needed you to know, I'm sorry. I'm proud of you. And I wish I had told you that every single day for the past 9 years. If you decide to reject the merger proposal, I'll understand. Sterling's problems are my fault, and you owe me nothing. But if you're willing, not now, maybe not for a long time, I'd like the chance to know you again. Not as the CEO needing something from the CSO. As your father. Or trying to be, anyway. Dad. I read it 3 times. Cried through the second and third reading. Was it enough? Could words undo 9 years of silence, of dismissal, of choosing Emma over me again and again? I didn't know. I called Dr. Morrison. I need an emergency session. We talked for 2 hours. About forgiveness. About boundaries. About the difference between reconciliation and letting someone off the hook. What do you want, Sarah? She asked finally. I don't know, I admitted. Part of me wants to make him suffer. Part of me just wants my dad back. Part of me thinks it's too late. It doesn't have to be one or the other, she said gently. You can hold him accountable and still leave the door open. You can protect yourself and still hope. They're not mutually exclusive. 3 days later, I sent my reply. Richard, I appreciate your email and your apology. I believe you're sincere. But I need you to understand, I don't need your pride now. I needed it 9 years ago. I needed it when I got into medical school. I needed it at my white coat ceremony. I needed it when I was working myself to exhaustion building this company while wondering if my own father would ever see me as anything other than a disappointment. I built Meridian without you. I became Dr. Sarah Chen without you. I proved myself without you. Your pride now doesn't change that those years happened. Your apology now doesn't erase the damage. That said, I'm not interested in revenge. I'm not interested in making you suffer. I'm just interested in living my life with people who value me. If you want to be part of that life, it will take time. Years, probably, and it will require therapy, family therapy, with a professional, because we can't fix this with emails and good intentions. It will require you to rebuild trust that you shattered. It will require you to show up consistently, to prove that this isn't just about your guilt or your fear of losing your company. As for the merger, I'm separating business from personal. Meridian will make our decision based solely on what's best for our company, our employees, and our mission. Not on our relationship. James will contact you next week with our terms. They will be extensive. They will be difficult. They will require significant changes to Sterling's leadership structure. If you're willing to do that to truly transform Sterling into a company worthy of merger, then we can discuss business. If you're willing to do the work of rebuilding our relationship, real work, consistent effort, professional help, then we can discuss that separately. But I won't confuse the two. And I won't accept half measures on either front. Sarah. I hit send before I could second guess myself. His reply came within an hour. I'll do whatever it takes. Both for the company and for us. Just tell me where to start. I forwarded his email to Dr. Morrison. Family therapy referral? She sent me 3 names within the hour. 2 weeks later, James sent Sterling our merger terms. They were brutal. Dad would step down as CEO, transition to chairman with limited authority, complete management restructuring. 6-month probationary period before the deal closed. Independent audit of all research and manufacturing processes. They accepted every term. 3 weeks later, I sat in Dr. Morrison's office with my father across from me. Our first family therapy session. I'm scared, I admitted in that first session. Scared that I'm stupid for even trying. Scared that he'll disappoint me again. Scared that I'm betraying myself by giving him another chance. Those fears are valid, Dr. Morrison said. Richard, can you hear Sarah's fear without getting defensive? My father's hands were clasped tightly in his lap. Yes, he said quietly. Sarah, I understand why you're scared. I've earned that fear. All I can do is show up, week after week, and try to prove that I've changed. It wasn't fixed. Not even close. But it was a start. 6 months later, the merger closed. Sterling Pharmaceuticals became a Meridian subsidiary. We kept about 40% of their research staff, overhauled their manufacturing facility, and discontinued their failed programs. My father showed up to every therapy session. Every single one. Even when he was traveling, he'd call in. Emma reached out after the 3rd month. Can I come to a session? She asked. I need to understand what happened. And I need to apologize. We had separate sessions with Emma. She'd known I existed, obviously, but Dad had convinced her I was struggling somewhere, that I'd made poor choices and didn't want contact. I should have looked for you, she cried during one session. I should have questioned his version. I believed him because it was easier. That hurt almost as much as Dad's original dismissal. But I understood it too. She'd been 20 when I left. Young enough to believe her father without questioning. A year after that conference room meeting, Dad and I had coffee. Just coffee. At a cafe near my apartment. How's the Alzheimer's research going? I asked. We'd salvaged one program from Sterling's portfolio and assigned it to a new team lead. Dr. Patterson thinks we might have a path forward if we completely redesign the trial protocol, he said. She's brilliant. Reminds me of you, actually. Good, I said. Listen to her. He smiled sadly. I'm learning to listen. Finally, we talked about science. About Mom. About how much she would have loved to see what I'd built. She knew, he said quietly. She told me you were going to do something incredible. I thought she just meant you'd be a good doctor. I didn't understand she meant this. He gestured vaguely at everything. She would have been proud, I said. My throat was tight. She is proud, he said. Wherever she is, I know she's proud. I let myself cry a little. He didn't try to fix it or make it stop. He just handed me napkins and waited. It wasn't perfect. There were setbacks. Sessions where I was so angry I couldn't speak. Sessions where he said the wrong thing, and I left early. Months where I couldn't handle contact and we only communicated through Dr. Morrison. But he kept showing up. And slowly, painfully, something started to heal. 2 years after that meeting, Meridian 4 got FDA approval, a treatment for late-stage lung cancer. The company value hit $5 billion. The day of FDA approval, my phone rang. Dad. Congratulations, sweetheart, he said. This is incredible. You're incredible. I smiled, tears running down my face. Thanks, Dad. It wasn't the first time he'd said he was proud. He said it a lot now, maybe too much, like he was making up for lost time. But this time, I let myself believe it. This time I let it matter.